At some point in most people's lifetime, they will have a need to visit an emergency room, whether for themselves or a loved one. However, in many communities, the emergency room is used for much more than purely emergent situations. They are being used for things such as the common cold, a stomach bug, broken fingers and toes, or flu-like symptoms. With that being said, you may be saying, yeah, so what? What's the problem with that? The problem isn't that the sick is seeking care at the emergency room for such ailments. The problem is the underlying issues that these types of patients are causing. That underlying problem is stress. Stress affects every aspect of an emergency room care and in turn affects all employees that work there. Today, I will be discussing 3 main points that surround the emergency room environment. First, the positive and negative stressors that are experienced by emergency room staff. Second, why it is important to discuss these stressors with the community and how you and I are affected as members of that community. Lastly, what can be done to combat this stress. To begin, it is important to understand that not all stress in the emergency room is negative. For example, a full waiting room may wake up one nurse's sense of value and create eagerness to fulfill the job, while a physician may become overwhelmed and experience anxiety. The U.S. National Library of Medicine, National Institutes of Health, has multiple articles that discuss emergency department stress. Within these articles, trending positive topics include collegiality, teamwork, respect, and positive social and professional support as important attributes to have among staff. Being a part of a team fulfills Maslow's 3rd step in the hierarchy of needs, which is a need for affiliation, love, or acceptance. This form of social acceptance is particularly important within the emergency department because it takes many nurses, physicians, and specialists of all backgrounds to provide the best or most appropriate care for patients. While there are many positive stressors within the emergency room, unfortunately, for every positive, there are many negatives. Some negative stressors include, but are not limited to, violence from patients and staff, repeated situations involving death in extreme painful patients, which is known as compassion fatigue, exposure to infectious disease, injury from workplace hazards such as sharps, chemicals, or equipment, the workload, staff shortages, and high turnover. The following is a clip from CNN broadcast just 2 years ago that involves an extreme example of violence against hospital staff.
Horror inside a Minnesota hospital, and it was all caught on camera. We should warn you, the video we're about to show you is pretty tough to watch. Officials say a 68-year-old patient attacked 8 nurses using a bar he pulled from the side of his hospital bed. This is the chilling surveillance video. It happened on Sunday, and what you can see is workers scrambling for cover as they realize what is going on. Michaela Ferreira joins us now with more. This is an unbelievable story, and you see it all play out here.
You really do, and what I think it is, it's a stark reminder of what healthcare workers face when they are confronted with a patient that goes on a rampage like this. Take a look.
While that was an extreme example of physical violence, a second example of extreme stress that goes unnoticed too often is compassion fatigue. The Merriam-Webster Medical Dictionary defines compassion fatigue as the physical and mental exhaustion and emotional withdrawal experienced by those that care for sick or traumatized people over an extended period of time. In 2010, Dr. Elizabeth Hall wrote an article for the American Academy of Emergency Medicine titled Patient Satisfaction: Why Should We Care? The article identifies the hospital as an important part of the community, highly valued and greatly depended on in time of need. So why is it important that you and I are aware of these stressors as everyday civilians? As patients and family members, we need our emergency room employees to be prepared mentally, physically, and emotionally to care for us. It can be challenging for these employees to perform well if they are concerned about their own well-being while trying to do their job. A key in understanding how we are affected as members of the community comes from being aware of what these staff members undergo because of us. If an emergency department staff member is under extreme stress and is required to perform a very intricate task or administer medication, for example, a panic attack could occur during this task, resulting in a horrible outcome. According to WebMD, an extreme reaction to stress is a panic attack. People who have panic attacks may feel out of control, like they are having a heart attack or about to die. Aside from panic attacks, chronic stress can cause problems for our loved ones that work within the emergency room. Chronic stress may present itself in a variety of ways, to include being overly tired, grumpy, antisocial, or even suicidal if it's not gotten under control quickly. Losing a family or community member to suicide can have quite an impact on society, and therefore we need to know how to look out for one another. Another interesting aspect to consider is the economical strain that we are placing on ourselves. Since emergency rooms cannot turn anyone away for care, charity care has become a challenge for many facilities. Charity care allows for uninsured or financially not able persons to receive care from hospital emergency departments, and in turn, that care is paid for by taxpayer funds, paying customers, and charity events. With charity care being so popular, overcrowding in emergency rooms and increased wait times are also problems you and I have created for ourselves. It was best stated by John O'Shea in his article, The Crisis in America's Emergency Rooms and What Can Be Done. He stated, "Because hospitals and their emergency departments try to be all things to all patients, they consequently fail to provide safe, effective, patient-centered, timely, efficient, and equitable care to many." As explained, we are causing unnecessary stress on these employees that may be chronic or sudden and can in turn cause potentially life-threatening conditions. What we do to them affects how we are cared for by them. If we want quick, reliable, and complete care, we must be aware of how we are impacting ourselves. So now that we have identified different types of stressors and how they affect you and I in the community, let's discuss what can be done. One strategy is creating more options for patients to receive care. Some options include telephone consults, extended hours, group visits, and open access scheduling. The great thing about these strategies is that they reduce the frequency to use the emergency department for non-emergent issues. A study performed in 2010 by the New England Healthcare Institute found that after the implementation of a call system, it reduced inappropriate visits from 41% to 8%. Whereas a second, 2-year randomized study found that chronically ill older adults attending monthly group visits used the emergency department 17% less than patients who were not enrolled in that program. Other than creating more opportunities for care, providing staff members with training to improve communication decreases stress as well. Communication training should vary from teaching how to communicate across cultural, religious, generational, and ethical differences among employees. Improved communication creates self-awareness. The College of Canyons explains, self-awareness is important because when we have a better understanding of ourselves, we are empowered to make changes and to build on our area of strength, as well as identify areas where we would like to make improvements. While it has been discussed organizationally what can be done to help reduce stress on emergency department employees, it is equally important to mention what family members, coworkers, and patients can do to help as well. Beginning with family members, much can be done at home to help. Encouraging healthy sleeping habits, well-balanced meals, good hygiene, and exercise as well as simply spending time together. Family is typically the main reason people work, to provide a home or lifestyle that is desired while striving for individual goals as well. Coworkers can help reduce stress among each other by having a genuine interest in one another and providing a support system. A couple of suggestions discussed in The Art of EMS by Steve Whitehead is to know how to say no and work trades. Work trades is described as finding the days that you really want off and trading with other employees so that you can be present for those events that really fulfill you. As human beings, we are not guaranteed a certain amount of time on this earth or a map with a defined route as to how healthy our lives may or may not be during that time. However, all people should realize and understand that we are living, breathing beings and that we get ill, accidents happen, and we all must die one day. Yet when tragedy strikes, we want to know that our local medical facilities can provide the care we need to prolong that life or help it come to an end with less pain. Unfortunately, all of the things we are guaranteed in life, stress-free emergency rooms is not on the list. But through the research conducted to create this project, one thing is sure. There is stress in the emergency room, but it doesn't mean it can't be reduced. As discussed throughout the project, stress comes in many forms. Some are good and others are not, but simply recognizing them is a step in the right direction.